What is dynamic support and key working in Liverpool? NHS England's Transforming Care programme was introduced following the 2011 Winterbourne View scandal. Its aim was to improve care for people with autism and learning disabilities and to move from hospital care into community-based care. Children and young people can, on occasion, be admitted to hospital during a crisis, and discharge back into the community is often difficult. Dynamic support was established to help improve and understand the needs of children and young people with learning disabilities and autism, or both, and to recognise early signs that might lead to a crisis. It aims to prevent children and young people from being admitted to hospital, or for the hospital stay to be as short as possible. Cheshire and Merseyside Integrated Care Board, known as the ICB, manages the dynamic support offer for Liverpool. This includes the Dynamic Support Database, which helps to track children and young people with increasing risks and to offer support at the right time. It helps professionals to monitor care needs and track those who are at risk of mental health deterioration or being admitted to Tier 4 mental health ward. Recognising the early warning signs mean we can step in quickly to provide extra support. To help with monitoring care needs, we have dynamic support key workers.
My job is to support and empower families while helping professionals coordinate care. I make sure communication is clear, that no gaps exist in a child or young person's support system, and that families feel heard and involved in decision making. As key workers, we are a point of contact for families and professionals. We listen to, support and work in partnership with families. We provide information and advice to build family confidence, follow up on agreed plans to ensure progress, and identify gaps in care and make sure professionals are working together effectively. When a child or young person is at risk of being admitted to a mental health ward, we work closely with families and agencies to prevent this. If hospital admission is unavoidable, we help make sure the stay is as short and smooth as possible. We support young people with autism and learning disabilities who may also face risks such as increasing and unstable, untreated mental illness, significant behaviour that challenges, history of hospital admissions, presenting in crisis at A&E departments, not previously known to learning disability services, supported in an unstable environment or by a changing staff team, recently discharged from a long-stay hospital bed, in an acute ward setting with mental health needs, including disordered eating, avoiding restrictive food intake disorders.
These are just some of the examples of things that dynamic support can help with. Our goal is to ensure that children, young people and families feel supported and empowered. If you need help, reach out. We're here to guide you every step of the way. If you want to know more, speak to your case manager, social worker, teacher, and contact the dynamic support team.